Welcome to JoyNews Desk. We're coming to you live from our studios in Kokomlemle. Coming up this morning, a grieving mother pleads for explanation for the tragic death of her 19-year-old son at the Ewim Polyclinic.
When we got there, only for me to know that the medicine was 7 cities. I thought that 7 cities, and they don't have it at the facility there. You let's go. So we were chatting with the driver. When we got there, I met my boy vomiting.
Health authorities in Eswejaman district concerned about increasing cases of bilharzia being recorded at health facilities. We'll hear from the medical officers there on the dire nature of the health threat. Plus, rising levels of water in the Volta River threatening the survival of flooded communities. We'll hear the plea of residents of Natiakra in the Pro-East districts as their homes, property and farmlands are submerged in flood waters, fast taking over several other communities in the Bono East region. My name is Aisha Ibrahim. We have business coming up shortly in this bulletin. My name is Aisha Ibrahim. Do stay for details. The Ghana Health Service is investigating the unfortunate passing of Nana Obing, a 19-year-old second-year law student at the University of Ghana at Ewim Polyclinic in Cape Coast. Nana Obing's mother, Nellie Mills, says she brought her asthmatic son to the hospital to administer a nebulizer treatment to prevent an imminent asthma attack. However, she alleged the medical staff administered an injection instead, which tragically led to her son's death shortly after. The Central Health Directorate says Nellie will have to wait for her answers after a thorough investigation and autopsy scheduled for the next 2 weeks.
I don't think anybody feels the pain I'm going through. If not, Ghana Health Service will not be sitting down.
Nellie Mills is grieving. She's unable to pick herself up after witnessing her son's untimely death at the Ewim Polyclinic in Cape Coast. She tells me that her heart is in flames and nothing will douse it until she gets satisfactory answers from health authorities.
I left the food. I went back to my shop with Isaac, thinking that he was eating, only for him to call me around 6:43 to say that I should come. When I opened the door and I can say, "Hey, are you not worrying me?" He said, "Oh, ma, it's as if my asthma wants to." And I said, "Oh, but there's no news, because if your symptoms wants to come, you've been using Ventolin all this while, and you have your Ventolin pump around here, so just use it." And he said he has read about the asthma, that if he used to use nebulizer, that would have been faster than the Ventolin.
A 19-year-old son, now being a second-year law student at the University of Ghana, perished at the Ewim Polyclinic while seeking to use a nebulizer to control his asthma.
When we got there, I saw 2 people there, one male, one female. I greeted them and I said, my boy was an asthmatic and he needed the help of the oxygen. Then the male guy shouted. I didn't know even Nana has already seated on the first chair there. Then the male guy shouted. But if he needed oxygen, was that the place for him? Masa, get up and go and sit at the third chair. And I said, boss, is this the way you treat people here? We've never been here before. So if where he is sitting is not the rightful place, I think you need to say it in a nice manner for him to move. You cannot maltreat my boy here.
Nellie said although she wanted to stay with her son, she rather chose to rush to the pharmacy to buy a prescribed medicine. But upon her return, Nana Obing's condition had deteriorated.
When we got there, only for me to know that the medicine was 7 cities. I thought that 7 cities, and they don't have it at the facility there. You let's go. So we were chatting with the driver. When we got there, I met my boy vomiting. He's vomited, and they gave me rubber or something that he should vomit inside. Something. And I said, what is happening? Then he got up, he became like a tent. So when I was shouting, they came to hold me that I should go out. Then my boy shouted that they've injected him. So I was asking, what injection? What injection? Nana is not here for injection. Who gave him the injection?
Nelly sits on the favorite sofa her son used to occupy in the living room. Her eyes are fixed on his dance videos on TikTok. She begs authorities to set her heart at ease by telling her why her son died.
I went inside only to go and meet my boy lying there lifeless. So I started shouting, hey, my boy is dead though, my boy is dead though. Because this thing, the underfoot were orange. Then they said he wasn't dead. I said, this person lying down. So they took me outside. Later I was there when Isaac came to ask me that one lady is saying they should come and ask me the boy's name, the date of birth, blah, blah, blah. And I said, but you don't know anything about my boy. And you've injected him. Who paid for the injection? Who? Well, we are not there with any health insurance. I never went there with any health insurance. Who even instructed that medicine? Because we're not there for injection. Only for them to declare him dead. I asked the cause of the death of my boy. Because I needed to know. And they said they don't deal with that. But they gather all cause of death and discuss it at the end of the month. So we should go and put our complaints on a paper.
Authorities at the Ewim Polyclinic told JoyNews that the Central Regional Health Directorate had ordered them not to speak to the media. Meanwhile, the Central Regional Health Director, Dr. Marion Oko-Usu, says a committee has been formed to investigate the cause of Nana Obeng's death. An autopsy has also been done and results will be ready in 2 weeks. But until then, Nelly Mills will continue to stay in his son's favorite seat, hoping the outcome of the investigations will heal her aching heart. Jojo Kobna, JoyNews.
Quite sad. Health authorities at Eswejaman district of the Eastern Region are alarmed over the high cases of bilharzia recorded this year. In 2022, the bilharzia cases stood at 22, but has since jumped to 75, representing 240% increase. The parasite that causes bilharzia enters the skin once individuals come into contact with contaminated water. We'll hear from the District Director of Health shortly, but first, take a listen to the Member of Parliament for the area, Thomas Ampem-Dakon, expressing worry over the increment in bilharzia among the people.
Indicates that bilharzia is on the rise, but I do not know if that is a direct consequence of the spillage by the dam. I don't think we have any evidence to that. But it is worrying to realize that in 2021, we recorded 15 cases. In 2022, it increased to 25. But as of last week, 2023, we have recorded 75 cases. And so that is a worrying trend. And so we have intensified education in the communities along the Volta, so that they stay away from direct use of the water from the lake. And so this is what I was talking to them about, and I have tried to put in some interventions that will give them alternative source of water, because most of them depend on the water from the lake, and so it is a worrying situation.
He was also unhappy about the unresponsive posture of NADMO after 160 persons were displaced following the Akosombo Dam spillage.
You know, the spillage started from my constituency, and so some communities very close to the dam recorded some incidents. So there were basically the buildings that are made of mud, collapsed, and we have about 50 of such homes that have collapsed, displacing the statistics from NADMO. About 160 persons have been displaced. The greatest effect in my constituency, as I put it, is with the cages in the water. The fish farms that are in the lake have all been destroyed. Cages have been moved, nets have been torn, and all the fishes have escaped, and lots have died. And that is a huge loss to the people there. And it is a worrying situation that we are all trying to contain.
We can now speak with the Sujaman District Health Director, Rebecca Bante, for more on the rise in bilharzia cases. Dr. Bante, grateful for your time. First, what could be accounting for the high cases in bilharzia this year?
Okay, thank you very much. Bilharzia is a water-related infection or disease, and it usually occurs in freshwater bodies. So it's a German finding itself along the Volta Lake, and bilharzia has been endemic in German. But looking at the numbers, as you rightly said earlier, or said by the MP, the numbers are increasing. Why? Because sensitization has increased and case death has increased. But I wouldn't say that it is directly related to the spillage or the flooding. However, now that the water is very close to the people, and then they frequently get into contact with the water, then and I see that we stand a chance of probably getting additional numbers.
So what interventions are you putting in place, to curb the spread, since you say it's contagious? Okay,
thank you very much. So now, in collaboration with VRA has its role that it plays with vector control. If we want to go into the site of how the disease comes about, how the mode of transmission, we'll get to know that there is a vector, the freshwater snail, that hides along the banks and weeds that are, closer to, along the water body. So VRA does that by removing all these weeds from time to time, and they also support the district with drugs that we frequently give out to school-going children and then some communities. The same way, Ghana Health Service is also supporting us with drugs that areas that are identified as having higher prevalence rates. We give what we call mass drug administration using praziquantel to ensure that adult worms are killed. So all that the district is doing is creating awareness for people to try as much as possible to avoid coming into contact directly with the water, because you can only get infected when you wade through the water, you swim, or fetching water, you come directly into the water, then the infected bacteria penetrates your skin. So if you avoid coming into contact with the water, then you are likely to prevent yourself. Also, those that depend solely on the water body, from the water from the lake, they are advised that either they boil the water or they sieve the water before they use it. So now sensitization and then hygiene practices and then mass drug administration are the strategies that we are using to keep the disease down. Also, for people not to sit at home anytime they have the symptoms, because awareness is created. So when they are sick, you seek help, medical help, as early as possible. So those are the strategies and many others that the district is using, in addition to support from VRA and the Ghana Health Service to ensure that the disease is kept. Thank you.
Rebecca Bante is a Sujaman District Health Director. Grateful for your time. Meanwhile, the Director General of Health, Dr. Kuma Boaji, has disclosed that psychologists will be deployed to flood-affected areas to provide victims battling with trauma following the dam spillage. Take a listen.
And we also mobilize our friends and some pharmaceutical companies to bring donations, including water, medicines, etc., not only to you, but to the entire community that have been affected. The regional leadership too has also been able to mobilize resources from other in the region and other districts to come in here and provide support at all the levels. Okay. We know that you have There have been psychological trauma, and so we have also engaged our psychological society. And I believe that this week they will also be here with their mental health team to ensure that they provide you the necessary psychological support as they October.
Well, joining us also on the line is Volta Regional Director of Health, Dr. Senenukwesi Jokoto, because we understand the bilharzia disease is prevalent there as well. Mr. Jokoto, grateful for your time. What's the situation in your area?
Thank you very much. Let me first clarify my position. I'm the Deputy Director of Public Health for the Mocha Ghana Health Service. My regional director is Dr. Kubio. I listened to the district director for Sejaman who eloquently spoke about bilharzia. I think most of that applies to us here in the Volta region, but what brings it into context is the fact that since we are all monitoring the case conditions over the past 2 weeks with regards to the effects of the flooding, we also noticed some bilharzia cases. But I'll state that, like was said earlier, these are disease conditions that are endemic in communities along the Volta Lake. Time there's been a lot of strategies to try and reduce the number of cases. We've had support from Ghana Health Service. We've had a lot of support from DRA as well. Even as I speak, we are also going to do the mass drug administration in all the communities along the Volta Lake within the Volta region that we live in Prazipantel. We are also intensifying risk communication and social mobilization so that people know when to come into contact with, what to do when to come into contact with water that are infested by bacteria. So I'd like to say that within the past 2 weeks, yes, we have seen cases of bilharzia, but they are not related to the flood that we are currently experiencing.
Are there plans to help the situation?
Yes, definitely. And the interventions are being intensified all across, especially because of flooding. We know that the water has come closer to people. More people are going to get in close contact with the vector that would transmit the bilharzia disease. So definitely we have to take extra measures and intensify what we are doing already to ensure that more people do not forget bilharzia or schizophrenia.
Dr. Jokoto, I'm grateful for your time. He's the Volta Regional Director of Health, and he says there's intervention to help curb the spread of bilharzia there. Earlier, you heard the Health Director of the Sujaman District also saying that they're doing well to ensure that they reduce the infection of bilharzia. Now, hundreds of residents of Fantiakura in the Pro East district of the Bono East region are appealing for help after the entire area was submerged due to the rising levels of the Volta River following continuous heavy rains. The residents who are currently living in a nearby bush say they are living with snakes and other reptiles and appeal to authorities for assistance. And Asabit has more.
Memunatu Al-Hassan, together with her husband and children, are 17 in number. They've lived in the same room here in Fantiakra all their lives. Sadly, however, they have to leave today to nowhere in particular after the entire Fantiakra community is submerged due to the rising levels of the Volta Lake following weeks of several rains.
Mikunu sune juma sai nti esra aban ba buaye ya same ye mobo aban hwe ye mobo na ombe buaye pa ba cho na nsuo no de ha na hai ya to akwa ha yin dai premier no so still wa satue ti pa ba cho se ombe buaye.
Maimuna, together with other members of the community, are today living in nearby bushes. She tells me that the owners of the land they are currently occupying are asking them to pay an amount of 5,000 Ghana cedis to stay on this land.
They say as I been on Mudia my assassin, no say, say, I thought 50 million, so any bidi, Nankaya Kotas, the Esra by so on boy, na new baby in that.
Maimuna is not the only affected victim here. Comfort Okrampa is one of them. She also shared her plight and appealed for support.
Yada in Siafa, Yakahaibisan, sister, and Siafa, Yasaka, and Nisika, the Kahantia, Solomon Quala, Fistan said to Munquala, Munko Studio, Yanya baby, and yes, come from Munquala Munko School. Yana na aqua. In time, I want to Papa Fantea, a Passa, or Yahya, now you say to me, a baby, see, I have say I am Siasa, so I'm not on my 50 million, we shall about him from Benya. The Astrasa, about boy.
Elsewhere in Sawukra, one of the several communities affected by the floods, Agbele Numare tells me that their farmlands have been submerged, rendering members of the community helpless.
Tio on the Hane Edmana, and in soon be fine about Abanisano, Edmana in Nabasan, Tiamite me into Edmanu Subio. In Tiafina Ede, ye per se, yes, I call Hasi, ne quede, and consider any or said a bear, a sabbat me aqua Edmanoso. By the hand there, yet me and continue Edmanu Habio.
He says they are currently living with snakes and other dangerous animals in the bushes, a situation that is hindering their movements. These homeless people who have lost personal belongings running into thousands of Ghana cedis are appealing to authorities to come to their aid. Reporting for JoyNews, Anas Sabit, Fantiakra.
Flood victims in Awade Kome in the Central Tongue District are heaving a sigh of relief after a visit by the Ghana Pharmaceutical Society. The society and the Director General of Health of the Ghana Health Service, Dr. Patrick Kumabwaje, who toured some of the affected communities in Kanus, observed the extent of devastation caused by the Akosombo Dam spillage. The over 200 residents received relief items and medical supplies worth 100,000 Ghana cedis and promised conducting free medical care for affected persons. Ivy Setoji has more.
The Ghana Pharmaceutical Society, led by the Vote Regional Branch, who toured some of the affected communities in Canoes, apart from the Abadiwe Kome in the Central Tongue District, noticed how devastating the flood was in the area, which made life very difficult for the residents. Members of the Pharmaceutical Society realized the entire community of Abadiwe Kome completely submerged in the water, leaving the community as a ghost town and making the over 1,002 residents homeless. The national president of the society, Dr. Samuel Kodonko, who led the team, has been speaking with JoyNews.
We are here now at Central Town, in precisely a town called Abadiwe Kome, where we've seen the displaced island, or people who have been displaced from an island. It's been an eye-opening experience. You hear reports, you read about them, but being here, seeing it live, a complete house submerged, that's right on my left side. I mean, this is very serious. We are now currently maybe on the farmland, and the farms are completely gone. So you can see the complete livelihood of people gone, just like that. It's really a sad story. I mean, being an eyewitness to it, I would say it's really a sad story. All I would say is that we have to do more to prevent such situations. Yes, we will put in the relief items, we will help those who are displaced, but we need to have
long-term solutions to this. I would also want to say, as a country, we need to really have an emergency relief fund that would always be sitting down. In times of needs like this, we need to fall on the emergency relief funds. Something that will not be so difficult for us to fall on, because these funds should be funds that probably are ring-fenced for such a purpose. We've just gone through a pandemic which was also had a major impact on the country and the economy, which was COVID. And we are having floods in some part of the countries. All these put together, Pharmaceutical Society of Ghana has already recommended that the country should have an emergency relief and public health fund set aside purposely to deal with such disasters.
Alex Gabi Hotoje is the MP for Central Tongue.
This is our document for you, and it's part of my constituency. It's an island, it's wholly surrounded by water, and within it you still have creeks. This is what you see these houses. That is the house of the assembly member, and with the water here, there are even reptiles like snake. So if you don't take time, you can easily be bitten by a snake. My fear too is that this morning it rained cat and dog. So apart from the man-made situation, which brought about the floods, the natural element is also rearing its ugly head. And this one we pray to God to save us.
The Dufia of the Bakpa Abadiwe Kome, Togbi Sakiti V, is appealing to government to equip NADMO so they can be able to bring enough relief items to the affected communities.
I was able to organize some few boats to do the evacuation. And we are safe here now. We have a lot of concerns, we have a lot of problems that we need to solve as individuals, and we have a lot of problems to solve as a country. So I am asking for a lot of help, support from individuals, philanthropists, and corporate organizations. Currently, our school is no more in session. The students are in the house. They have to go to school. But on that fateful day of evacuation, I did not see anything from NADMO. So I'm asking the government to equip NADMO so that they can act. They can have their emergency team beef up. I have to raise my own resources with my assembly member to do a whole lot of things. And you can see, taking care of about 1,200 people. It's not a child play. The last time the Vice President was here, the Assistant Director General of NADMO lied that he was able to evacuate the people, which he didn't. Not even a single life jacket was given. I wanted to meet that young man one-on-one on TV or anywhere. The way he was able to do the evacuation, he should tell us. My people know that I am the one with the assembly member who do the evacuation with the help of other chiefs and citizens. So I don't know why he will be lying to the whole the general public that they were able to resource, do the evacuation and other things.
The Director General of Health Services, Dr. Patrick Kuma Abuadi, who also toured the area, pledged to make sure that affected residents of the flood are provided psychological support and adequate health care to make sure that they are able to pull through the traumatic experience of the flood.
We know that there have been psychological trauma, and so we have also engaged our psychological society, and I believe that this week they will also be here with their mental health team to ensure that they provide you the necessary psychological support as the October requested.
The Pharmaceutical Society has however donated hundreds of medical supplies worth 100,000 Ghana cedis and relief items to all the communities in the Central Tongue district and promises to mobilize more for the affected districts. Ivy Satoji, JoyNews, Abadiwe Kome.
The dangerous proximity of galamsey and sand-winning activities near water bodies continue to severely impact the operations of the Ghana Water Company Limited, resulting in up to 50% treatment losses, particularly in the western region. The managing director of the company, Dr. Clifford Brymer, disclosed this during the 2023 edition of the company's Accounting to the Customer initiative in Accra. He emphasized the gravity of the situation, revealing that wastewater from mining firms in the western region surpasses the quality of water in the Ghana Water Company Limited's reservoirs. My colleague Carlos Coloni was there for JoyNews.
The 2023 Accounting to the Customer event by the Ghana Water Company Limited, GWCL, saw the presence of Dr. Freda Prempeh, the Minister for Sanitation and Water Resources, alongside a Deputy Amidu Isahaku Chinia. It brought together staff and customers from all 13 operational regions to Accra, with each region showcasing their innovations aimed at improving water quality and customer satisfaction. Speaking at the event, Managing Director of the Ghana Water Company Limited, Engineer Dr. Clifford Brymer, expressed his concerns about the adverse effect of galamsey and sand-winning activities, highlighting that wastewater from mining firms surpasses the quality of water in the company's reservoirs.
One is galamsey. Some of our stations, because of the high turbidity levels, instead of doing 5% process loss and having 95% as clean water pushed into the system, will do as much as 50% process losses. And so between the 95% and the 50%, the 45%, the customers that were supposed to supply with it, who is going to do that? Water is not available for us to push in. And that's the challenge that we have in some of the centers, especially if you go to Takoradi. It's a big issue for us. Surprisingly, the chief manager and his team, I asked them to do a test of the quality of the water that the mines discharge and throw away. They went to do the tests, and the quality is far better than the one that we have in our reservoir that we're supposed to be using to treat it for you.
Dr. Brymer also pointed out that revenue losses due to illegal connections and illicit dealings by some unscrupulous staff and customers are among the significant challenges hindering the company's smooth operations.
A customer had his meter that was not read over a period, and our staff had the courage to talk to the customer that the readings on your meter is so high that if you want to bill you, you pay more. He negotiated with the customer to pay 1,500 out of 3,300 or 3,500 thereabouts. And this 1,500 is meant to go into his pocket. Unknowing to him, he was being monitored from day one.
Despite these challenges, Dr. Brymer maintained that the company is making substantial progress in terms of revenue and water quality.
2022, we collected 1.235 billion Ghana cedis as our revenue. And we are proud to say that from the auditors, we are qualified to have the ISO 9001-2015. And we've been assured that by the end of December, we should have that certification. What it means is that the quality of water that we produce, we can tell you that up to your gates, which is our responsibility, is to the standard.
The company has acquired more than 400 magnetic and ultrasound clamp-on meters, which have been installed at 90 water systems to combat water theft. Carlos Caloni, JoyNews.
Management of the University of Ghana says it will continue to implement its latest policy of reserving all traditional halls on campus for first-year students. The Old Vandals Association has taken the management of the university to court over claims the policy will eventually convert the all-male facility into a mixed one. Reacting to the concerns, however, Vice Chancellor of the University of Ghana, Professor Nana Bapia Amfo, says the school is only implementing residential policies which is aiming to protect the most vulnerable sect of the university community. She also advised university alumni to refrain from forcing their views on university management.
That was out there that this management led by my good self has turned the hall into a mixed hall, or had the intention to turn the hall into the mixed hall. Nothing like that has ever come up in all the discussions, in all the committee discussions and the eventual council decision. What the policy that we put out there, which we are implementing, is for us to reserve the traditional halls for our first year students, and that happens right here in this country. In other institutions, you go to KNUST, you go to UCC, that's exactly what happens. We are rather late coming to this late in the day, and that's what happens all over the world. You give priority to your most vulnerable students, and your most vulnerable students are those who are coming into the institution for the very first time. With regard to Commonwealth Hall and parts of Mensa Saba Hall, we implemented for the other halls, it's a gradual implementation, but for these two halls, we implemented the policy fully immediately, also because of the disturbances that were going on at the time between the students of these two halls. So I needed to yes, I needed to clear the air on that.
So you still go ahead?
Oh, the policy is being implemented. Yeah.
Which means technically?
Oh, which means that these halls and all of the traditional halls are reserved for our first year students and graduate students. So you come into the hall, first year level 100. After level 100, you would have to leave the hall and make room for the new set of fresh students who are coming in. So you leave the hall and find accommodation in the other halls and hostels on campus, the UGL halls and other private hostels on and around campus.
What do you feel this sense of entitlement, if we may have to describe it that way, is coming from or stemming from? Is it a matter of ego, prestige, you know, brotherhood, if we can call it as such, because the males have dominated over the years?
Well, Blessed, I told you that this whole matter is in court. So, I mean, when we are done with that, I'll be happy to sit down with you and have a full conversation around this, because I do not think that you can.
We've been joined by the Deputy Ranking Member of Education on the committee, Education Committee of Parliament, who is himself an old vandal, Dr. Clement Appak. Grateful for your time, Doc. What do you make of the insistence of the university's decision to actually implement its latest policy of reserving all traditional halls on campus for first-year students?
Well, Aisha, let me say good morning to you and to viewers. Well, I think the management of the University of Ghana has every right to, if you like, create and implement policies. But the challenge we have is that the university ought to understand that management is not the only stakeholder as far as the university is concerned. And it is the case with any institution of higher learning. I say so because alumni has a role to play, and alumni has always played a role, both in terms of mobilizing financial and other support to assist the university and universities to achieve their goals and objectives, and also intervening when and where necessary. I am glad that the Vice Chancellor, whom I have known for several years, in fact, we both studied in Norway. We were both at the University of Bergen. We both resided in the Fantop student hostel. And I am her senior, by the way. And I am glad that she has acknowledged that there is a case in court and that she wouldn't want to speak to it in terms of the impasse that has brought about that current policy that she spoke to. But you see, we have long argued that our hall and our tradition, which is obviously an envy of other competitors, has been targeted over the years. And we are of the opinion that what happened on the basis of which this policy was introduced was all orchestrated to try and dismantle the brotherhood and the fraternity that we enjoy exclusively as students and alumni of Commonwealth.
Interest of the university to target just one hall.
Yes, actually, it is obvious. All of this that they are talking about, all of these policies, it is all to ensure that there is no quote-unquote continuity in terms of students who enter first year and are in Commonwealth Hall, so they can go along to final year, because their perception or their analysis suggests that when the students are in the hall, then the seniors are able to, for lack of a better word, indoctrinate the juniors into our peculiar ways of being vandals. So by only taking in first year and then saying that after that you need to go and find another hall, and that they are only going to bring graduate students, they clearly are breaking that learning process where seniors will be there to orient and indoctrinate juniors, which then keeps our tradition going. So all of this arrangement is targeted at Commonwealth. I can say that without any fear of favor of contradiction.
The university says the decision aims at protecting the vulnerable sects of the university. What would you have had the university do in the current situation it finds itself?
Well, the university doesn't have a problem. This is not the first time that we have had challenges on campus. And it is not only confined to the University of Ghana. It is not only confined to Commonwealth against Sabah or Commonwealth against Lagos. I mean, it happens in UCC. It happens in the KNUST. And even in the renowned universities in other parts of the world, if you were to look at the history of Cambridge and Oxford, they have fraternities. It is not unusual. But the reason why we feel targeted is because of what happened and how it was dealt with. How is it that you claim that there was a fight between members of Commonwealth Hall and another hall? You were not able to provide evidence, even when we challenged you. And yet you went ahead to suspend the hallmaster and tutor of Commonwealth Hall, and to suspend students of that hall. Without providing the evidence, you have gone on to act on a report that was written by a committee whose composition and work we are even contested. So all of these matters we are taking to court. So if you look at the circumstances, the context, the reaction of the university, their inability to answer questions that, the Old Vandals Association had presented, their inability to provide the evidence, because they claim that they had CCTV and all of that. And we asked for all of those pieces of evidence. They never made them available.
I'm sure.
And we know for a fact that on that fateful day, on our side of the information we had, there were vast loads of young men who were brought on campus who were not members of Commonwealth Hall.
Well, that's your word against that of the university. We are hoping that this matter will definitely be settled in the court. Dr. Clement Park is a deputy ranking member of the Education Committee of Parliament. Let's take a break on JoyNews desk. When we return, there's business.
Hello, my name is Emma Davis. Let's do some business news. Technology company Techno has unveiled the Techno Future Star Initiative in collaboration with University of Ghana. The scholarship program is poised to recognize and support the remarkable talent of undergraduate students across Africa who are driving technology change. The scholarship program is worth 100,000 cedis. There's more in this report.
Has introduced a scholarship scheme dubbed Techno Future Star Initiative in partnership with the University of Ghana College of Humanities. The scholarship scheme is an initiative that embodies the very essence of Techno Ghana's mission and values, a journey that is not only significant but transformative. The Techno Future Star Initiative is an exceptional scholarship program designed to empower and inspire young talent majoring in STEM subjects. As part of this initiative, Techno will be awarding 100,000 Ghana cedis worth of scholarships to 20 deserving students.
We are looking no further else than where to get knowledge. And so investing in knowledge, I mean, you can never go at a loss, because you are giving people the knowledge to survive on earth. And so choosing Legon and choosing education is just the right way to give back.
Professor Daniel Frimpong Ofori is the Provost, College of Humanities, Legon.
It's an extremely important initiative. It's a trailblazing initiative because it's the first of its kind that Techno has entered into in any country and in any university. So here at the College of Humanities, we consider ourselves as the pace setters.
EcoBank Ghana has pledged to support education projects in the country. As part of its 10-year anniversary, the bank will refurbish the computer laboratory of the South Labone Girls Technical Institute. According to the acting managing director, Joanna Mensah, the gesture is aimed at developing the digital skills of students to keep them abreast with the growing technological world.
Ghana, as part of its corporate social responsibility, plans to improve teaching and learning in the South Labone Girls Technical Institute. The donation forms part of the bank's commitment to sponsor the school to facilitate effective learning and research. In an interview, Managing Director of EcoBank, Joanna Mensah, said the development of the digital skills of students remains critical.
Basically, EcoBank wants to support, social activities and also help to bring the poor, up and also develop the community. So corporate social responsibility is usually the theme of this EcoBank Day. So this year the theme is Excel with Digital Skills, and so we are here to donate some computers to the school. We came to do some inspect 21 computers. There's a computer lab. We'll refurbish it and then put in the computers to help develop the digital skills.
Principal for South Labone Girls Technical Institute and Shelter for Abused Children, Gifty Tekpo, thank EcoBank for its timely support to the school.
We've been hoping for this since 2020, and today has come to reality. So we are very grateful. Before we lacked so many things to help us train these young ones under our care. But when we wrote to EcoBank Ghana, they responded to our request and then came down here to supply us with things that we're not even expecting. They are going to renovate about 4 classrooms for us, furnish it with furniture, and then our ICT lab is going to be well equipped. So we are very grateful. It's a dream come true for the institution. we have to maintain it so that it goes a long way to support even the next generation. So as we call on them and they responded, we know when we call on to other institutions, they also continue to support us to give, maintain the equipment donated to us.
The school was urged to uphold a good maintenance culture.
That's all for business. My name is Emma Davis. For more business news, do log on to myjoyonline.com.
And that's how we wrap up the bulletin this morning. My name is Aisha Prime. Log on to myjoyonline.com. There's more of the news and updates of all the developing stories. See you again at 12.